Hi guys. I know it's been a while. I've tried to make several videos and for some reason they are not uploading. So, oh man. All right. I need to pull I have some resin pieces I need to pull out because they're done and, well, they might be a little sticky. That's okay. I'm still going to pull them out. And then while I'm doing that, I'm going to talk about the stuff that's been going on. Okay. So, 2 weeks ago, I went to meet a Dr. Mark LaValle. He is local to York and Harrisburg area. If you see my dogs, just ignore, please. They are going nuts today. He is well known. He works with the Olympics, the United States gymnastics team, and he also is a bone and spine and joint specialist. He is most known because he has Elhers Danlos himself, and he prides himself on being able to diagnose it and help others, especially because he and his son both have it, and he tries all of the techniques that he recommends to his patients before recommending them. So he knows what we're going through. He knows what's happening, and when we try to talk to him, what to expect and what to look for and stuff. So he is really, really an amazing doctor. I highly recommend, if you have any questions or if you have any belief that you have Ehlers-Danlos yourself. Also, a little quick warning, I'm having a very, very rough day. I keep twitching and I'm very shaky. I'm having a very hard time getting around. So if you see, I have my cane right here. One of my dogs knocked it down, but I'm having a very rough day. So if I pause or I'm stumbling a little bit, that's why. It's not you, it's me kind of thing. So anyway, so 2 weeks ago I met with Dr. LaValle and went through all the symptoms and stuff. Like, I sent my background ahead of time to give him some knowledge of the situation of what's going on, and he read through everything. I had basically a list for 15 years of what had been going on and what I had been tested for and stuff, like some of it repeatedly, my thyroid, rheumatoid arthritis, Lyme's disease, stuff like that. I have been repeatedly tested. MS I was tested for twice, and every time it came out normal. So after sitting down with him and going through all of the stuff, he started walking through some of my symptoms, and then he started doing the physical exam. So the physical exam part, what he did was basically flexed all of my joints to see if they hyperextend. And by hyperextend, I mean, like, most people, their fingers can go back a little bit maybe, but they can't go back like that. Or your elbow is normally straight, mine bends upward. My knees also bend backward a little bit. So what he's looking for is to see if they all do that. So like my thumb can touch my wrist, my fingers can go backward. Both of my elbows hyperextend, both of my knees hyperextend, my joints are and my hips are extremely mobile, and then my feet, since you can't see them, I'm just going to do a demonstration because it's just too rough to pick them up right now. My feet, when I lay down, it takes effort to actually make them stay up like that. Normally they're like that. So when I'm laying down at night, my feet are flat or in-turned or out-turned or something, some way, but they are never just straight up. It is very uncomfortable. It takes, like I said, it takes effort to actually do that. The only thing that I didn't have was a full-on dislocation. I have 2 ribs that almost dislocate, but it's not quite. And that would be on my lower left side. So it's very, very painful. I have to have help to put them back in. But So anyway, we went through all of my symptoms, and so far, I'm going to go through my symptom list. I have it right here, and then we'll go through what is treatment plan, okay? So I was diagnosed with Ehlers-Danlos. Let's just start with that. I was diagnosed with Ehlers-Danlos syndrome, benign hypermobile form. It is like one of the most common forms of Ehlers-Danlos because I am hypermobile. It doesn't really affect my vascular system as much. Like there are forms that are very rare or very difficult to live with, like more so than this. But there is a treatment plan, and it starts with diet and exercise. Dr. LaValle said the biggest thing is going to be exercising. He said basically it's going to be your lifeline, the thing that keeps you going, and it's going to suck and it's going to hurt, but it's going to help stabilize my joints. Right now there is not enough collagen to stabilize my joints with just the ligaments and stuff that is in it. So what he said I'd have to do is actually start lifting, like body lifting and stuff, or weightlifting, and I'll start working with a physical therapist in a little bit to try to get underway, just get started, and get trained on that, and then I'll from there work on it with somebody else, and then I'll do it by myself. I need to do a workout every day. He said like 4 to 6 days a week I'll do lifting, and then the other days I will do some form of cardio, which I can't run. I shouldn't be doing yoga. I know that's not cardio, but the best cardio exercises for me are low impact, which is going to be an elliptical or swimming. And we did go through all of that. Like he gave me nice long descriptions of everything on my chart. So, but as far as the pain, he put me on a medication similar to Prozac. I know I've heard some iffy side effects and stuff with it, but honestly, it really does help manage some of the pain. The reason that I'm also on that is because I have anxiety and depression, and it is listed. He said that most people living with chronic pain and fatigue, within 6 months they're experiencing depression and suicidal thoughts. And I've been going on this for 15 years. So he said it's honestly a miracle that I have such a joyous personality and character and stuff. I know today it doesn't seem like it, but it normally is. But to keep everything up. Hi, no thank you. Not right now, okay? This chair's not big enough for the two of us. To keep myself going. It's a miracle that I was able to do that. So, that should help with the anxiety and the depression. I still have a lot of anxiety when I go out in town, especially like today. I almost had to get a handicap cart, like one of the motorized ones, and I probably should have had it to help me get around, but I did not want to do that yet. I'm like, I was so, I don't know, I don't even know the word. I'm not ready for that yet, and I could have used it, and I'm very tired from just walking around a store for 10 minutes, but I did not want to do that yet. So, next thing was IBS, which is called irritable bowel syndrome. Collagen is a big player in your gut health, and supporting those tissues and stuff. So the main thing right now is getting that under control, and making sure my gut is working the way it should be. And you're going, okay, well, how do you do that? Well, let me explain. Okay. So basically, a normal person or an average person, I think he said, gets between 5 and 10 milligrams of fiber a day, and they're fine with that. That's good. That's okay. A person with Ehlers-Danlos needs 20 to 25 at least milligrams of fiber a day. So I have to drink fiber in the morning and then have a high fiber diet as well as a high salt intake, because I need to be able to drink more water and take in more water, and I'll explain that in a little bit. And that helps absorb it. And then high veggies and fruits. So the main thing is, because my gut doesn't work like normal people, I need to watch what kind of food I eat. So low carb. He said no white bread, potatoes. Like, I can do sweet potatoes, but no white potatoes, no white bread, no white pastas. Try to go for whole wheat and stuff like that if I need to. Honestly, I'm trying to cut out some gluten as it is. So what I'm doing is, if I can avoid it, I'm just not going to have it. So, like, no breads and stuff like that. And that just, I will have pasta with the kids every now and then. If I do, it's whole wheat. Or I substitute it with like quinoa or something like that. He said was fine. So last thing is called POTS. It's postural orthostatic tachycardia syndrome. Basically, and it's not all of the time. If I stand up too quickly, my heart will start racing, but my blood pressure also drops, which, worst case scenario, I would pass out. Sometimes I see bright sparkly lights. I call them fairy lights, and I feel very strange when it happens. Honestly, I think it's really neat, but it's also very weird, because it feels like there's fairies dancing around me, and I feel very floaty. And then if it's not that, I get very lightheaded, and I'll see, like, my vision gets very dark and narrow. I've had that happen pretty often. I'll even go from, like, if I'm bending over and I stand up too quickly, that happens. Or if I'm in the shower and it's too humid or something, sometimes it happens. It's just one of those things. And that's where the water comes into play. He said to help with that, I need to have about 100 fluid ounces of water a day, which you're going, wow, that's a lot. So with my fiber in the morning, what I'll do is I will take a drink that has electrolytes in it, and I might take some when I'm at home at night, or if I'm out in town, I'll grab a drink with electrolytes in it just to keep my sugars up and to help out. And the rest of the time, I try to get in 4 to 6 bottles of like 16-ounce waters. So I have cups at home that have 25 ounces in it. So I'm like, okay, I just aim for 4 of these a day, and that's fine. Even if it's 3, that's good enough for me for now. So this is still a work in progress. I go back in a couple months, and I am also going to get together with a psychiatrist or something to talk about what else is going on with the anxiety and the depression, and see what else, if there's something else that might be going on with the Ehlers-Danlos diagnosis, because a lot of times people with Ehlers-Danlos have either ADHD or they're on the spectrum in some way. So we're just going to keep moving and keep pushing and keep trying. My husband reminded me of that today, because I sent him a message. I was like, yesterday was really, really bad. like one thing ruined my entire day. Are you coming over? And I honestly was just, I could not function yesterday at all. It was really, really bad. And then today I'm up and I'm mobile, but I am really fighting to stay up and to stay moving. I am trying very, very hard. And I texted my husband and I was like, Matt, you know, today is a really bad day, and they're all on vacation. I came home because the dogs have been really sick without me, so I came home to be with them, and I sent him a message and I was like, listen, I am struggling really, really hard. I might not get much done today because like I'm having trouble walking. I'm in a lot of pain. I'm very, very shaky. I was having trouble lifting things and getting around. I think my dog's eating a feather. But he said, you know, trying is still better than just stopping. So that's the best I can do for now. That's what I'm gonna do. Just keep trying. So for now, I'm gonna do some artwork because I can sit down while I'm doing it, and I really enjoy doing stuff with resin. This is my little molds for ear gauges, because that's one of the things that I wanted to work on today. I got like gauges with geodes in it. This is one of the things that just keeps me going, that I really like to do. And I know it sounds silly, but you know what? To each his own. This is one of them. I don't know if you can see it, but this is an ear gauge, okay? And there's an earwig in it. I found these bugs outside and I was like, these would be cool inside my gauges. So I want to put them in there so you could have an earwig in your ear. I know it sounds gross, but it is what it is. There's one in each of these, but I can't see them. I think they're too dark. I'm gonna have to try again. I need to go find some more earwigs. That was funny though. It's a funny one. I'm hilarious. So anyway, if you have questions about Elhers Danlos, please message me, or you can always look up Dr. Mark LaValle, or you can visit a site, elhersdanlos.org, I think it is, for more information, especially if you think you have it, because most doctors, it goes severely undiagnosed or underdiagnosed because it is not well known. I was out in town today and had some questions from people about, you know, me, because I have my braces on my knees and I had my cane and I am hobbling around, especially with my right leg is really bad today. I was struggling very hard and talking to people, trying to get it more well known. People would ask questions about what was going on, or just talking out at checkout about it to some people, like the cashier and stuff, and they would ask questions like, well, I've never heard of that. Like, well, what can I say? Like, do you have time for a 10-minute discussion about what it is? Instead, it's just like, you know, the easiest way to explain it is it's very similar to MS, except instead of it being inside your mind, like your brain has lesions and stuff on it, it is, my body is just falling apart because there's not enough collagen. So it's like, how do I explain this to make it the easiest way? And that's probably the best one that I could think of right now. So I'm sure I'll come up with something else, but for now, that's about as good as it's gonna get, right? But I don't know. Anywho, I'm gonna get going. I've got some stuff to do, and then get this posted up on the YouTube for everybody else. So, all right, guys, have a good day. Message me or post comments if you can. I'll try to get back to everybody and answer any questions you have. Okay. So for now, stay safe, stay healthy, live your life. Okay. Keep trying.